Assalamualaikum. Assalamualaikum and very good morning. I'm Ms. Noaiza on behalf of Musi Malaya Center for Continuing Education, UMCCED, would like to welcome all distinguished guests, ladies and gentlemen, to this public event. Our topic of discussion today is preparing teacher for children with special needs in an exclusive preschool classrooms. And today we are honored to have with us a speaker who has a distinguished experience working with persons with neurodevelopment disability. Ladies and gentlemen, the number of children with special needs in preschool classroom has increased each year, and preschool teachers are currently facing serious challenge of teaching children with varying abilities in the same environments. It has been established that the teacher is the most important component in ensuring inclusive in the classrooms. And in order to increase the success of inclusive practice, they should be prepared to teach in a diverse classroom environment that includes children with and without disability. Before we start, may I introduce our speaker for today. Professor Dr. Kenneth Poon earned his doctorate in early childhood, family and literacy, a lead intervention focus from University of Carolina, USA. His expertise is in clinical psychology and early childhood special education. In Singapore, professors serve as an elected board member of the National Council for Social Service, the president of Rainbow Center, and the vice chairperson of the Board Catholic Family Life. Internationally, he is a council member of the International Association for the Scientific Study of Intellectual and Developmental Disability, and is on the editorial board of the European Journal of Ecological Assessment, as well as infants and young children's. Ladies and gentlemen, I'm pleased to present Professor Dr. Kenneth Poon of Nanyang Technological University, Singapore, and to invite him to begin his talk.
Thank you so much, Aiza, and a very good morning. Selamat pagi to all of you. Very, very happy to be here today. Just give me a minute as I get my slides up. So again, I think the topic of that I'll be talking about today is really how can we, as teachers of preschool children, include children with special needs in classrooms, in our classrooms. So over the course of today, you will see that I'll be posting in my slides a couple of QR codes. I'll talk about what you will find in the QR codes. This is partly also so that people who find what I'm saying a little boring, you can start to look at something else, or you can go more in depth into further content. So today I'm just talking about my work that I'm doing apart from the university. A big part of my university work these days is actually working at the Center for Research in Child Development, where we try to understand the needs of children as they develop. So on the first QR code that you see on the top right hand screen, we have some information of the center that my colleagues and I work at to further understand the development of children, at least in Singapore. So, that's not the main focus of what we're talking about today, which is really to understand children with special needs. So, what I hope to do today is to structure my talk into two main parts. In the first part, we will be, and there'll be a fairly shorter part. I would like to just talk about what special needs are. What do I mean when we say special needs? And what does it mean for teachers when we talk about special needs? So that's the first part of today. I hope to take about 15 to 20 minutes on that. And then the second part of the talk is when I want to be looking at the question of now that we know that there are or there could be children with special needs in our classrooms, what can we do? and what can we do in a way that is possible for us as teachers? Because one of the things that we always worry about as teachers is that, oh, if I have one student in special needs, I still have the rest of my students in the class. How am I going to support them? So I want to share some ideas for thinking about what can teachers do to support children with special needs in the classroom. And then I hope to have maybe about 5 to 10 minutes at the end to hear from any questions if any of you do have that. Okay, so that's the focus of today's talk. So the first question then for me is what are special needs? So I can say first of all that special needs is definitely not just a name that you take and you stick on a child. That is very clear. That is not what special needs is all about. Um, it's easy to say what it's not. The entire process of thinking about what special needs are, how of figuring out whether a child has special needs is much tougher. So instead of what we do sometimes is that when a child is diagnosed with a special need, sometimes there are names that we give, names like autism spectrum disorder, names like attention deficit hyperactivity disorder like ADHD, names like global developmental delay, names like dyslexia or reading disorder. So there can be many of these names, and sometimes it gets a little confusing if we are not people who are working with these names all the time. I think for us as teachers, it's useful for us to know what the names could be. And I would think that over the course of our work, I will encourage teachers to learn more about these. But what I want to talk about today are not the names or what I call the diagnostic categories, but rather I think that what we as teachers need to pay attention to, apart from maybe knowing what these names are really is really the question of now how does special needs impact or how does special needs affect our children, the children in our classroom. And so, what one thing that we do very frequently in early childhood is to look at three main areas that are important. I purposely put conceptual skills last because many parents always think about that first. When we think about early childhood, they always think about, oh, is my child uh, um, able to read? Is my child able to um, add or subtract? That is important. But I think in early childhood education, we are also very concerned about the holistic development of the child. So we are very interested in the area of practical skills. Now, is your child the child in your class, is the student able to take care of himself or herself? Is he able to uh, in an age appropriate way? Okay, because all these are developing skills. Are they able to go to the toilet? Are they able to know that it's time to go to the toilet? Are they able to feed themselves in a way that the rest of the children are? Are they able to move around the class without problems? Are they able to stay within the class without problems? Are they able to follow the routine of what's going on in class? So these are all aspects of what we call the practical skills aspects of things. Very important. I'll put it within there the basic safety skills as well that the child will need to know. I think that's one major set of skills, and we don't always think about that, but that's one very important aspect that we think about in preschool classrooms. Another aspect which we sometimes don't think about unless there is a problem is this entire aspect of social skills. Is the child able to get along with adults, with the teachers, with other adults in the schools? Are they Do they know how to greet them? Do they know how to interact with them? Are they able to get along with the other children in the class? Do they know the rules? So these are the broader aspect of what we call social skills. Do they understand how is it like to be living with other people? Equally important aspect. And in fact, if you think about it, although many of us think about the third aspect, which is the conceptual skills, these two aspects are actually among the most important things, because if the children that we are looking at have weak practical skills or weak social skills, they are going to be struggling when they enter primary school or elementary school. And of course, in the conceptual skills, apart from the reading and writing and the math, we are also asking ourselves, are the children picking up the right language that they need to learn? So there is the broader question of how is their language development. But for us, as we think about the academic aspects, do they understand the language for academics? Do they understand more? Do they understand add? Do they understand take away? So, and at least I'm talking about that in English, but I think you will apply to any other languages that we are looking at as well. So, for me itself, as a teacher, then, regardless of diagnosis, these will be areas that I will be thinking about, because a diagnosis or a name like ADHD is only going to be a name that helps to look at some of the characteristics. But at the end of the day, for me as a teacher, I still ask myself, is the child able to take care of himself or herself? Is the child able to get along with other people? And is the child learning in class? So let me try to illustrate that or show that a little bit about how we can be thinking about these areas with this figure over here. So you will see on the next slide that I have two figures. One that says autism spectrum disorder, and what I have down here is a boy, Zul, who is 5 years, 2 months in at kindergarten level. It might be a little different here in Malaysia. And what we see is that uh, with Zul that you're seeing over here, because of his autism, he responds to adults when the adults come to him, but he ignores his classmates. Conceptual, in terms of his practical skills, he's a messy eater. He's a little on the clumsy side, and he, in a conceptual way, um, can interact with other children, and he reads very well. So I mean, I think this. So when a child comes with a diagnosis of autism spectrum disorder, for me as a teacher, these are things that I want to be thinking about. So what I'm asking you to do is, as a teacher, the important thing is not only to know the diagnosis, but really to know about how our children in our classrooms are doing, and to understand the developmental needs. Likewise, on the figure on the right, we have Andy, who's a 6-year-old boy. And what we are seeing down here is that Andy has a diagnosis of ADHD, or attention deficit hyperactivity disorder. And what you can see over here is that he doesn't always get along with other classmates, but he's interested in them. He's able to take care of himself. He's got good motor skills. But in the case of Andy, he is inattentive, has his struggles with reading. And so what you will find is that for children with ADHD, for children with ASD, two children can have the same diagnosis, but what they are able to do or what they're not able to do is going to be different. So it really goes back to now, even with a diagnosis of special needs, we really need to understand the child. Let me tell you one more point that is why is it important to be looking at things this way. And that's because even though we know that we are quite able to make diagnosis now quite young, not many of the children, especially when they're in preschool, may not have the diagnosis yet, because no, they have not been to see the doctor or the psychologist. But as a teacher, we will still see them in our classrooms. So what I know is that teachers are generally very able to understand from a very short period of time who are the children who do not fit in. But what teachers sometimes don't do as well in is to really put a good diagnosis on the child, and that's because that's not the training of the teacher. Uh, I think what am trying to get at today is really to be saying that for us as teachers, whether the child has a diagnosis or not, the important thing is really for us to understand how the child is doing and how we are able to further support the child. So what you will see on the next slide is something that we call an ecological congruence assessment. That's not my invention. That's the based on the very work or the very good work of Mark Wallery and his colleagues. The third person, Jen Isa, was my classmate. Uh, and what we are looking at in ecological congruence assessment is really to ask ourselves the important question that an educator needs to ask. And what we do in ecological congruence assessment is to ask ourselves, it's not uh, to try to diagnose the child, but to ask ourselves now, during the course of the day of the child in school, is the child fitting in? And that's what we're meaning about ecological congruence. Is the child fitting in with the rest of the children in the environment? So in this case, what you are seeing on this figure over here is in this table over here is that on the left hand side there are the activities that can be happening during preschool. So it can be arrival and departure. We're looking at snack time. We're looking at toileting and hand washing, and the list can go on for as many of the routines that we have. But very importantly, one of the questions we want to be asking is the child adjusting? So the question we ask is the child doing the same things as his or her classmates, as other children in class? Then if yes, then there's probably no problem, right? The question is that if the child is not doing the same thing, now what is he or she doing? And what are other children doing? How are they different? And then the question then is that sometimes children might be different from other children. That's fine. If they don't need help, but if they need the help, then the question is, what kind of help does the child need? Does the child need some help in paying attention? What we call getting engaged. Does the child need help in staying engaged? Meaning that, do I need to redirect the child so that we get the child to look again at what they are supposed to be looking at? Is the child having difficulties getting along with other children? Or is the child not having the skill uh, to do the activity? So, for example, if I'm having a big book session with my other children in the class, uh, is the child if the child is sitting down, watching, and staying within his or her space, but doesn't understand what I'm talking about because the child cannot read. So what we are seeing is that the child does not, in this case, have the skills to read, to learn to decode the word in the big book activity. So what an ecological congruence assessment does is that it helps me as a teacher to figure out the areas in which the child struggles with. So that's all I want to talk about when we are talking about special needs, because for us as teachers, our important thing to be noting is to say, now, if the child has difficulties adjusting in the areas of social, in the areas of practical skills, in the area of conceptual skills, how is it impacting, how is it affecting his or her uh, ability to get along in the classroom? Okay, so that's the first part of what I'm talking about today, which is to get a sense of um, does the child have special needs? What are the areas that the child is struggling with? Once we have a sense of what that is, then the second thing that we want to do after that is to ask ourselves now, now that we know that the child is struggling, then what can we do as teachers, right? So, and what can we do as teachers? And many teachers will tell me that, you know what, I'm not trained in special needs, so I don't know what I can do. Or some other teachers saying that, you know what, I, I know that the child needs help, but I have no time because I have got seven other children in class, or I've got nine other children that I'm supposed to take care of. So, as the picture over there tells us, uh, I believe that all teachers can do something, and the thing that we can first start off by doing is to really take the first step. And for me in Singapore, first in Singapore, that's something that we have we have thought of, and we have for some time. And one of the things that happened for many of the children with more significant or more serious special needs in our preschools is that many of them struggle to even find a preschool that would take them. So I was very privileged to be part of a task force, a national task force in Singapore, to try to better understand. Um, Sorry, actually, one of the things that I forgot to say, if I go back over here to the QR code that we see at Ecological Congruence, is that if you were to scan the QR code, you actually have some further description of how you can do an ecological congruence assessment. So if you want to dive a little bit more deeply, I think that will get you into a resource that some professionals in the US have put together to help us to help teachers think about how to engage in a ecological congruence assessment. So coming back to this work group, so I was because of the issue of many of our preschools in Singapore having many children with difficulties because of special needs, or what in Singapore we call that developmental needs. I was very privileged to be part of a task force in which I co-chaired to actually study the issue of what can we do to further support um, our children in preschool. So one of the things that we have done moving forward is to pull together a report. And in this report, one of the things that we did was really to state our vision, to state our vision for all children, but particularly children with special needs in preschools. And this vision over here is what I have highlighted in yellow. That our children with diverse abilities, so children with the whole range of things that they can do or cannot do, will be able to learn, to play, uh, but um, more importantly, that they are also able to contribute. That means they can bring something to the class and participate meaningfully. So it's not just sitting in the class, but being in the class and doing something that is meaningful for the child and alongside other children in a preschool. So that is really our vision. And over in Singapore, one of the things that we are currently trying out now is that we have six demonstration. We have six preschools that are specially funded to include children with special needs, so as to have a better sense of how can we go about doing that. So that's a lesson, a little experiment that we are doing nationally in Singapore. And as you can see in the figure over there, There are some aspects that we are looking at. There is some specialized child support. There is some other support for the within the preschool within the preschool. There is support for family. But what I want to be focusing on today in my talk is this aspect of what teachers can do. That teachers can be empowered to further support the child. And what you will see on the QR code that I've included over here is really the access to the report if you want to take a look at some of the ideas that we've had. So part of our work that we did as a task force was to really speak to preschools, to speak to parents. And also one of the most fun part was actually to visit preschools, both in Singapore as well as internationally, to get a sense of what they have been doing to support children with special needs in the classrooms. So before I go on to the next part to share 4 ideas that we can be thinking about for supporting children with to include children with special needs in our preschools, I want to start off by looking at what research says, because we conducted this study in Singapore, and it's done internationally as well. And always we have the same issue. Usually people will say, "Oh, I think it's nice to have children with special needs in schools. That's a good thing." But another thing that parents always say that, "Oh, it's okay to have children with special needs in my center, but I don't want my child to sit next to a child with special needs." This is something that we call the "not in my own backyard" symptom that we see not just in Singapore but internationally. But what we do know from research is that it's something that is not as well, is a view that is not supported by research, because we know that when preschools are supported to provide the kind of resource to provide support for children with special needs, the first thing is that what we know about with preschool inclusion, our children with special needs do better in terms of their social emotional skills. They first of all get a better sense of belonging with the class. They also develop better socially because of the interactions they have with their classmates. This social emotional strength is not only seen among children with special needs. What we also do know from international studies is that their classmates, when they are well guided to support children with special needs, actually develop also in their social emotional skills in ways that they will not develop if they had no children with special needs in their class. So we know that they start to learn more kind of helping behaviors. They know about what is a better way to talk to other children. And one of the things that parents are most concerned is that now, if I have a child with special needs in my son or daughter's class, will my child learn all the bad behaviors? What we do know from international research is that the classmates are not negatively affected, particularly when the teachers are able to correct the behaviors. Then, very importantly, we feel very strongly that if we want a society to be inclusive, we want a society, a community around us to know that we can accept everyone around us and to learn how to live with people who are different from us. An inclusive classroom is the first step where we start developing children with the right mindset to be living in a diverse and inclusive society. So that's a very important thing. So this aspect of inclusion in preschool actually lays the foundation for, if you think about it, it lays the foundation for a society that we want. For us as teachers, we also know that teachers who are able to include children with special needs also end up developing stronger pedagogical skills and also feel that they become better teachers. So there are a lot of good strengths to becoming to including children with special needs. So what can we do? 4 points, 4 slides. The first thing that I would like to suggest is that, and this is sometimes the easy, it looks easy, but it can be sometimes the hardest, because what we are asking here is to really uh, have a change in attitude. I think that the first step of really including children with special needs is to really believe that, um, the children that we have uh, in our classrooms are first, they're not autistic children, they are not dyslexic children, they are not children with intellectual, they're not people with Down syndrome. They are first of all children. And for us as early childhood educators, that's who we are actually trained to teach. We are trained to teach young children. And they are first of all young children. And so for that reason, the first step really to making a difference for these children is really to really have the room for them in our hearts and have the room for them in our classrooms. So first of all, I mean, I think the work of Salon, which is a fairly nice textbook, has listed a few points that they can get teachers off on the right footing for including all children in their classes as we want to include them. So the first aspect that Selen talked about was to view all students individually. So very frequently, when as a teacher in the preschool, I have my expectations of what my students can do, but I think what we want to be doing is that yes, there are expectations, but also to keep in mind that everyone is different and it's okay. But even though uh, some children are different in some ways, I think one of the things that we want to be doing in inclusion is to say that everyone is different, but uh, we are all at the end of the day the same. I think I've spoken to one pediatrician who used to say, you know what, if we look at our hands over here, you'll find that some fingers are thicker, some fingers are thinner, some fingers are longer, some fingers are shorter, but they are all fingers. Uh, and some fingers can bend more, some fingers cannot bend as much. And that's also like us people. In many ways, children can be different in many ways, but at the end of the day, they are still children. And so for us as a teacher in the school, what we want to do is to really recognize the strengths, recognize the positive things of all the children, what they can do, but also to be providing the kind of help to the children who are struggling, either in behavior or in learning or in helping to pick up the practical or social skills. And I think many of these things can be read and is self-explanatory. But the last point that I want to raise is really something that we don't always think about as teachers, but it sometimes makes all the difference for the children in the school. Very frequently, our children with special needs are the children that always have a lot of people helping them. But do they have the chance to help other people? And sometimes, in many cases, they don't. And the question for us teachers is that are we giving them the chance to learn to lead, to learn to help others? Because that also is helping to build their social emotional skills. So point number one, we teachers can change our way of thinking, that we can have a heart that can be promotive of inclusion in a preschool classroom? The next thing that teachers can do, that I think all teachers can do, that is really to be thinking about the classroom environment. Like when I have many students in the class, I cannot pay attention to all the children all the time. Or rather, I'll be taking a look and I try to be supervised, but I'm trying to focus on. Uh, but I may not always be able to focus on every single child, or if I find that there'll be sometimes some children I need to pay more attention to. So one of the things that we know that we will be that can actually help this entire class, what I call classroom management piece, is really to be thinking about how we design our classroom. Of course, the amount of space in a classroom is something that we cannot change. The kind of fittings, like which of the cupboards or shelves which are fixed to the wall, I cannot change. But there are some things that I can change. I can change in terms of what I set up in the classroom. I can change in terms of how I let my children in my classroom move about. I can change in terms of how I put my furniture in the classroom. So, what one of the things that you see in the picture that um, over here, I'm not sure whether you're able to see my arrow, but that's the picture right in the middle of the slide. Is that that's not my classroom, but what I took to be a fairly nice example, because that classroom has a few things which are nice, and I apologize for the size of the font, but let me just highlight a few things. The first thing that the classroom has is that um, it's not all open. And that's what I refer to as traffic flow. I think how traffic flow refers to how the children are moving around in the classroom. Are they all crowded in the same space? And that happens when I have all the children in the same area at the same time. In this classroom itself, you'll notice that there are very clear zones in the classroom. And so when there are clear zones in the classroom, I can split the children I have in the class into different zones. So that way I can first of all set very clear rules about where the child is supposed to be and what he or she is supposed to be doing in that area. So that's managing where they are. And if they are given that space, then they will have to do less movement around. How much traffic, how much movement I have in the classroom depends a lot on the students. If I have a child with cerebral palsy who's not moving around properly, I might need more space around so that the child can move from one part of the classroom to the other. But if I have children who are going to be very active, who sometimes try to run out of the classroom, then I will need a classroom with a little bit more structure in the space, like what you're seeing down here, so that they know where they are supposed to be, and it's going to be it'll take them some time to run out of the classroom. So that's what I'm thinking about at one level in terms of the traffic flow. Another thing I'm thinking about is safe spaces. You will find that some of our children with special needs can get quite overwhelmed in the classroom because of other children, because of the sounds, because of the difficulties that they might be having in learning. So that sometimes can be a little overwhelming for them. And so when the child gets overwhelmed, sometimes they misbehave because they don't know how else to cope. So, are there spaces like that? Are there spaces in the classroom for children who are struggling? Uh, it what these safe spaces are depends a lot on the class, depends a lot on how much resources we have. But in all cases, we can set up a safe space. So sometimes I know of teachers who have bean bags in the classroom or cushions where the children who are having a tough time can stay there by themselves, of course under supervision. I know of there are some spaces where um, teachers even have tents in the classroom. We don't have that as frequently in Singapore because of supervision, because of hygiene purposes. So we don't have that as much. But many of my colleagues in the US have such spaces around. One thing that I see a lot in my classrooms in Singapore is that very frequently there's a book corner with one or two comfortable chairs down there. So that is sometimes transformed into a safe space for children who are having a hard time, and teachers say, you know what, I think you might want to uh, spend maybe 10 minutes in that space for a while to calm down. And I'm just trying to, so that can sometimes be done. I just want to clarify that a safe space is not punishment. So it is really somewhere for the child to just spend time away from the rest. Okay. And the layout of the classroom, which I've talked about slightly earlier. Okay, so two ideas for the teachers' attitudes and mindsets. That's number one. The second is to be thinking about the how we go about shifting the environment. And I'm looking at the clock, so I'm going to move on to the next two ideas. The third idea is really to ask yourself now, is what can I do in the course of the day that I can help the child out. And that's what we call routines-based intervention. That's thinking about. No, you see, as a teacher, I will find that if I have many students in the class, I will find that it's going to be very hard for me to know. Okay, now for my student Daniel, what am I supposed to do to help him develop, especially? It's going to be tough. Because I need to be paying attention to everybody else in the class. And I will rightly say that I have no time because there are so many things to do. What routines-based intervention does is that it really asks the question of, now that we have, first of all, we think about now what happens during the course of the day. So again, as you see in the table down there, there are some routines. There's arrival, there is circle time, there's transition time. So to ask yourself the question of now, if we do have these times during the day, which happens in a preschool classroom, what can I do for my student Daniel during each of these areas? So for example, what you're seeing down here are three goals for Daniel, and within each of these goals, you can actually put in some special goals for your student with special needs, so that you will pay special attention to the student during those routines. So if I were to just take the first goal that he will make, this is a toddler, okay? He will make sounds or gestures to express her needs. So, for example, now what can I do during arrival time that I want to be practicing with Daniel every arrival time? What do I want to be doing with Daniel in terms of communication during circle time? What kind of things do I want to be hearing from Daniel during transition time? So, if I were to be spending maybe about 10 minutes every day for just planning about what I want to do for my child with special needs that day, what you're seeing down here are three goals. And I'll just say that, okay, during arrival time, I want to be to give him a chance to say yes, so that he can practice communicating. We also want to get him to say something during circle time. So if I have those as my goals, then that way, am I doing something to help Daniel? Yes. But am I going to be spending more time than is required? No, because that becomes something that I'm going to do anyway as a teacher. But except that this time around, I'm planning to do that, and I'm a little systematic about the kind of support I can help. So the steps are down here. So think about what goal to teach your child, find out what routines when the goals can take place, and then to think about what can I do within that routine to give the chance the child the chance to either use that goal to show that goal or to practice that goal, and to ask yourself as a teacher, now how am I going to give the child the chance to do that? How am I going to teach that in that routine? And so if we're able to do that, we will find that we'll be able to give multiple practice for the child through the day. And again, in the QR code down there, you will see more information, not by me, but by people who have been developing resources on the net where you can actually be finding out some ways to give the child some routines. Okay, I'm going to talk about the fourth one, and that's the easy, well, can be easy, but it's obvious, but we don't always do that. And that goes back to the point that really um, the parents of the child are the experts of the child. So the first thing I'm going to ask is, are we as teachers welcoming the parents to be in our classrooms, or are we telling the parents, please stay outside because you're distracting the child? I believe that the more the parents come in, the more the parents will be able to take whatever they're learning from the classroom and bring home to teach their child. So, first thing, welcome the parents. Second thing, give yourself some time to communicate with the parents, either physically. Many teachers I have now are texting the parents, either using WhatsApp or Telegram or short messaging, whatever you are using. And I think very importantly, also to ask parents, especially when you say, you know what, um, uh, the John is not sitting down in class. He doesn't pay attention. And parents say, no, he can. So to understand from the parents, how do they go about doing that? Of course, if the parent says that, oh, my child can sit down all day, and say, how does he do it? I turn on my TV or I give him YouTube. That's not what I want to encourage as a teacher. But sometimes parents have good ideas. And the parent might say, you know what, he doesn't like doing a lot of things, but he likes coloring. And I say, maybe that's something that I can be using. So to get ideas from parents. Okay. So 4 ideas that I've shared, how do we pull them together? So this is a framework that my colleagues and I have introduced several years ago. Nothing special about the framework, but what we are actually looking at is a system that is linked in together, because I'm talking about planning every day, but what do we plan? What are we going to do? So the first thing, the first part of it is assessment, knowing what to teach the child, what kind of goals to set for our students with special needs. Because with some children with special needs, if I want to go and think about goals, I might have 23 goals to work on the child. That might be too many. And we don't know where to start. So for me itself, the first step is always an assessment. And I talked about ecological congruence assessment in an earlier slide. So that's when I might want to consider during the course of the day, what are the areas that the child is struggling with? And then depending on how much time we have, I might choose 2 or 3 goals, if that's all the time I have. The second thing I want to do is to say, now, with that, with knowing the goals, what do I want to plan so that the child can become better? So in this example over here of Daniel, who is a 4-year-old child with developmental delay, it can be that, first of all, I want to teach the child more vocabulary because the child's language is delayed. Another thing is that the child finds it hard to understand the instructions in class. So what I want to be doing as a teacher is that I might want to explain in simple words after I've explained to the rest of the class. The third thing I want to do is I might want to work with the parents to help to tell the parents, you know what, these are the few words that I've introduced in school today or in this week. Maybe the parents can take it back and try to use the words at home as well. And so those might be, so the assessment is what do I teach, what are the areas I want to focus on. The planning is what is the best way to teach the child. The implementation is how are we going to do that? Who is going to do that? How often are we going to do that? And as much as we can, now as a teacher, put it in my daily routine. Because if I'm able to, is to say, okay, I'm going to teach a child more vocabulary. But the question for me, as we want to be systematic about implementation, is now which routines am I going to teach? How many times a day am I going to be doing that? What words do I want to be introducing to the child? So if we are able to think about that, and then to say now, how are parents going to practice that if we can partner the parents? Then we are able to ask ourselves at a certain time, is this helping? So again, how often do we review? Now that depends a lot on the setting that you have. There are some teachers who say that, oh, I do a review every week. That can be a little hard for us. Some of us might be saying, I want to review that once a month. Some of us will be saying that maybe I only have time to do it once a term. But as long as we have a cycle of providing this support, of assessing, of planning, of implementing and evaluating it, there'll be more and more chances for our children to improve and to make progress. In a sense, this is my little sharing for today, to give you a sense of what we as early childhood teachers can do to support our children. And I've got a list of resources here that you can be looking at as well. Thank you so much.
Thank you very much, Professor, for spending your time to share with us your expertise on this topic today. Ladies and gentlemen, if you have any question, please leave your question at your live chats. And for now, we have one question from YouTube from Madam Nisa Nazim. How do you assess a student with disability for their strength and weakness? Number two, how do you propose we harness their strength for their benefits?
Thank you so much, Madam Nisa, for asking this question. And I want to say that I really like your second part of the question. I think that's something that we don't always think about as teachers, and that's how do we harness their strengths. What you will find is that very frequently for children with special needs, we always say, "What are the problems?" And it sometimes can be hard for the person with for the student with special needs, because all their life they're only going to see people who are going to help them with their problems. And what we know is that with special needs, very frequently they have special needs for a reason, and they are not going to get over the problems easily. So the first thing, then I'll take your second part to make it your first part, actually, which is to understand the strengths of your student and to encourage them and to find ways of saying, you know what, never mind, you've got other problems. We will tackle those problems, but we want to be giving them more recognition for their strengths and to give them to practice their strengths as well. So because their strengths will be a way in which they can feel good about themselves. Very importantly, the strengths are also a way in which their parents can feel proud of them. And their strengths is one thing that we can actually get them to be interacting with their classmates about, so that they have a balanced perspective in life. My research now is bringing me to interacting, to understanding children with special needs in secondary schools. And many of them come in with this understanding that I cannot do things because I have special needs. I think it's very important for us to think about how can they go about doing things. So with regards to the first part of the question, how do we assess? I think as teachers, the first thing I will do is to do an ecological congruence assessment, which is to say, now, in the course of a day, in my classroom, what are the areas in which the child is adjusting, which are the areas in which the child is not adjusting, how much support does he or she needs, and those might be the goals that I want to be selecting.
We have two more questions. One from Teacher Ita. Hi sir, how do you educate parents in a right way if we as a teacher found that his or her children got special needs character? Nowadays parents are a bit denial.
Yes, teacher Ita, thank you for raising that. I was wondering because for me, that is my number one problem that teachers have in Singapore. They always tell me that, and I have the chance to talk to teachers of preschool children, teachers of secondary, of primary school, secondary school children, even in teachers of even lecturers of uh, of of adults with special needs in universities. They are all raising this as one of their big problems. Is that I know that this child, this person, my student is different, but the parents are in the word denial because they don't recognize that. Uh, I think that first of all, looking at the experience of people around me, uh, I think that many parents have this journey in life. It's not denial. It's sometimes it takes them a while to come to terms. For us as teachers, we always look at the child and we say this child is not adjusting. But for parents, they have many other things. Sometimes they compare. Sometimes they compare with the siblings. Sometimes they compare with others, and sometimes their comparison is a little different from ours because as teachers we see the rest of the children, so they don't always recognize that. The second thing is that sometimes parents deal with other problems. In Singapore, sometimes they deal with the grandparents who do not agree that the child has special needs, and so the parents find it very hard to do anything. Sometimes they don't get support from their husband or wife. uh, and sometimes it's just too hard for the parents to come to terms because they've got dreams for their child. And to say that their child has special needs can be very difficult for some parents. So I think, or in some other contexts, we might find that um, it's just too difficult for to identify the children. So at the end of the day, remember my first part of what I've talked about is to say that uh, what as teachers, it doesn't matter what diagnosis the child have. Really, we want to be looking at what are the areas that the child is struggling, and to ask ourselves what can we do to support. So for me itself, if the parents are not ready to talk about special needs, the thing that I will do is to say that as a teacher of your child, I find that the child has difficulties adjusting in two areas. Let's try to work together to see what we can do to help your child in school. So then it's not talking about special needs or no special needs. It's really thinking about how can we do best to help the child develop. um, Most parents will agree to help this way. And then you find that sometimes as you are helping the child more and more, the parents sometimes gets more open to be seeking professional help if the child continues to struggle.
Okay, Prof. Another question from Facebook. Dear Prof, what are the present interventions that can be included in classroom to help children with self-management skill?
Okay.
Children,
Children with autism, self-management skills. Thank you. It depends on what you're thinking about as self-management skills. I think that if we think about, I'm not very sure whether we're talking about self-care skills or whether we're talking about self-management as to managing how they are behaving or how they are managing their own emotions. So it depends on what we're thinking about. I think if we're talking about routines, we first start off by, again, the ecological congruence assessment, seeing what the child is struggling with. Sometimes, as teachers, we want to target the areas which are the hardest to address. So, for a child with no words yet, sometimes saying that, "Oh, I want the child to talk," can be something that can be quite difficult. Uh, Depending on the child, sometimes I'll go for the smaller success. And so I will target the skills that sometimes requires the least effort. Uh, and so as to give yourself and the child and the parents some success experience. So I sometimes might choose one difficult, one long-term plan and one shorter-term plan, so that I can manage that. Now, if we look at if you're talking about self-management in terms of how the child is able to control his or her own behavior or his or her own emotions, that is a far longer term plan. Uh, One of the things that we are currently struggling in our we're currently engaging and studying in our research is this thing called executive functions, and that's the part of our brain. We know that executive functions are located just behind our eyebrows, in the brain over here. We call that the prefrontal cortex. uh, that is something that is involved in depending on what you call it, self-control. Very frequently, uh, in educational psychology, we talk about that as self-regulation. So that aspect, what we do know is that it only comes to maturity way into adolescence. So there's actually a lot of self-regulation takes a long, long time. So, but it can start from infancy. So, how do we do that? I think we start where the child is ready. Vygotsky talks about the zone of proximal development. So if we want the child to be fully independent, to be able to manage, to control his own behaviors or emotions, that could be too far out from what the child is ready. So we want to be seeing now what is the child capable of doing. So again, if we look at the ecological congruence assessment, it's how much support does the child need. So I ask myself, now what is something that I can just introduce a little support and the child can be independent in that part? That is close to what or when I look at any behaviors, I ask myself, what is the child passing? If the child is passing, no problems, I don't have to teach. What is the child failing? Then I can't teach. The question is, what is in the emerging area? Now that gives me a sense of that falls within the child's zone of proximal development, what Vygotsky calls it, and what I can do as an adult to help scaffold the child.
Okay, another question from Facebook, Norzaini Youngs. Do teachers in Singapore have aids for each child with special needs? In Virginia, they have aids.
Okay. I think I know who asked this question. um, we, I think the answer to that is that it depends. So, not it's not automatic. It's not automatic that children with special needs in Singapore have AIDS. No, um, we are still trying to gear up, together with the completion of the report. One of the things that we started off was that we wanted every preschool in Singapore to have a special need, an inclusion coordinator, what we call ICOs. And that is something that we want one teacher in the school to be aware of the kind of services around. And this person doesn't need, it's a very short half day training just to give the person some understanding of the kind of resources around to be supporting, so that they can be the point in which every preschool will have to do referrals to different places, to be talking to parents. That's our first step. What you will find is that in our preschool, our inclusive preschools, which are still currently at pilot phase, we have teacher aides. And that's because we're putting in resources now to help the teachers out a little bit more. But the teacher aides are there not to pull the child out. I think what's most important actually in inclusive education is that we want to keep the child in as much as possible. Um, if the teacher aides are not used properly, then it become like extra babysitters. Uh, and that's actually what we know from research that when a child has someone behind the child all the time, that doesn't help the child in inclusion. Actually, the aides are there to provide the additional support so that teachers can actually spend more time focusing on the smaller groups of children. So no, so the answer is the short answer is no. We don't have it for all preschools, uh, but it's something a resource that can be helpful.
Okay, Prof, we will take last question, also from Facebook. Dear Prof, how does Singapore special education and inclusive program differ from other countries? And what countries were main influence in creating the special education program in Singapore?
Okay, um, very good question. I think that our system is a little different from it's this it's very different. It's also similar in some ways. I think one of the things that Singapore has is that we make it a point to support children with special needs in our schools. Um, we don't I don't have the numbers for preschools, but in our regular schools, in primary schools, we know that 80% of our children with special needs are in primary school. Only 20% are in special schools. So our main thing that we want to do is that if the child can benefit from the curriculum, we really want them to be learning with the rest of the children. And we want to be providing the resources for them. So I think in that way, we try to be inclusive as much as we can. I think another way that we are different though is that we still in Singapore recognize that uh, we are able to provide a lot more support for some children with special needs when we have concentrated support. So, like in our special schools, we have physiotherapists, we have psychologists, we have social workers, we have occupational therapists, we have speech and language therapists, and we also have special facilities. So we recognize though that as much as we want to be inclusive, for children who require a lot more support, uh, we do bring the children together so that we can have all the professionals providing the support for them. For us in preschools, we also have a similar kind of system. I can't give you the rates because I'm not so sure, but we have this thing called EPIC centers. Those are specialized early intervention centers for children. But even in those centers, they only spend maybe about 2 3 hours, about 3 times, 2 to 3 times a week. And most of the time, our children with special needs are with either at home or with other children in preschools. So I think that's one of the things that is different from many countries. It's different because that is different from the policy of many countries, but we do know that many of these countries also do have special needs. So also have special schools. So on what system that we go about, I think we try. I don't think there's a single system that we try to base our learning on. But one of the things that we try to do is to pick up whatever lessons we can learn from wherever we can in the world, uh, if it can be applied to our setting.
Okay, thank you again for your times, your willingness to share of your idea and tips very much appreciates, and I'm sure all of us have something to take away from this session today. Before that, don't forget to all the participant to fill the Google form for the attendance. With that, I would like to close this session, but also thank you all the participants for taking part in our public talk today. Thank you.